Hello, everyone, and welcome to our eLotus webinar. My name is Donna, and today I will be your host and moderator. For over 2 decades, eLotus has been your trusted source for continuing education for acupuncturists. We offer one of the largest selections of online CEU courses with over 3,000 CE hours. If you are new to eLotus, don't forget to sign up today for an eLotus account and receive a free 1 CEU course as a welcome gift. This offer is valid for new customers only. As an educational institute, we want you to be successful, which is why we offer free resources available for you to help build and strengthen your practice. If you're not familiar with the Tcm Wisdom Tube, it is a free educational portal designed with health professionals like you in mind. This is where you will find all of our archived 1-hour weekday webinars. These presentations are filled with clinical gems and information that you can use in your practice. I will put a link for you in a minute in the chat room. All right, so the big thing everyone is talking about right now is the coronavirus. We wanted to let you know that we have translated an article on how it's being treated in China right now. I will put a link for you in the chat room too, and please feel free to share this article with your colleagues or on social media as you see fit. Also, during this difficult time, we want to help you understand more on how to treat the common cold, flu, and allergies. So we decided to share 2 of our best classes on treating respiratory diseases with you for free. If you log into your account right now, you'll find these 2 courses, one by Dr. Jimmy Cheng, who's famous for pulse diagnosis and herbs, and the other is Dr. Chen Lao, a speaker we invited from Taiwan to give a Chinese seminar, but later we translated and voiced over the entire class in English. We hope you will gain insights on how they treat respiratory conditions to further refine your treatment skills. So before we get started, here's a quick introduction on Dr. John Chen. He is a recognized authority in both Western pharmacology and Chinese herbal medicine, and is the lead author for the Chinese Medical Herbology Pharmacology, Chinese Herbal Formulas and Applications, and Chinese Herbal Formulas for Veterinarians. To learn more about the herbs he will talk about today for viral infections, you can get his books at www.evherbs.com. All right, so let's go ahead and welcome Dr. Chen.
Hello, everyone. It's a pleasure to be here. Before I start, let me do a quick voice, audio, and video check. So if you can hear me and see me, please go ahead and type in the chat room so our tech knows everything. Oh, looks like everything is good. All right. So my topic today, is going to be the treatment of influenza and other viral infections. And what I like to do today is mainly first to paint a big picture of how these type of conditions have been treated by Chinese medicine in the past, and then follow up by some of the most commonly used herbal formulas as well as single herbs. As I usually do, I will be discussing about herbs and formulas from both Chinese medicine and Western pharmacology perspectives. That way, you can see from an Eastern and Western perspective how they actually work and understand it, and also explain it to the patients. All right. One of the first thing I want to do is just quickly point out the big picture. The influenza season this year has been quite unusual, and the reason I say that is because, generally speaking, you had the flu that start to affect the general population around December or so, and that usually peaks in January, and then from that point on, you will then slowly decline and eventually thin out over time. But what happened this year is there is a double hump, meaning you had influenza B that was quite common in December and early January, and then in late January and early February, you have influenza A that hits. And overall, at this point in time, there is approximately 22 million cases of influenza, 250,000 have been hospitalized, and about 14,000 deaths associated with this year's influenza. All right, so from a big picture perspective, at least here in the United States, this has been a bad season for influenza. And obviously, the headline these days is all about the novel coronavirus. All right, and this is obviously something that's quite severe in China. As of today, the number is there are 75,000 cases and 2,100 cases of death or so. And then in the US, so far there is 15 confirmed cases. All right, so the idea here is even though coronavirus is all the headline is what most people are talking about, I think on a clinical and more realistic cases, what we are really dealing with as TCM practitioner here in the US is mainly the influenza. All right, so that will be the main topic that we'll talk about for today's lecture. And then toward the end, I will also mention a little bit about coronavirus, but not too much. All right. So with that, let's go ahead and get started. And what I like to quickly do is give you, get in the time machine and give you a quick historical view of how Chinese medicine has treated these type of infectious disease. Obviously, one of the most famous practitioner in Chinese medicine is Dr. Zhang Zhongjing. And it's quite interesting because he lived at a time in the transition of Eastern Han to the Three Kingdoms. And what happened was that was a period of time in Chinese history where there was constant war. And the war is then complicated with a lot of famine and starvation and malnutrition. And then on top of that, there was also a lot of epidemic at the time. So what happened is within a 10-year span during that time, about 2/3 of the population actually died. Okay, and out of the 2/3 of the population that died, about 70% of them are affected with some type of cold disease. And that was the inspiration of why Dr. Zhang Zhongjing wanted to become a physician, to see what has happened to all the people around him and also his family. All right, so anyways, that's how he started to study medicine. He practiced, and then toward the end of his career, he wrote a book called Sanghan Zha Bing Lun, basically about the discussion of cold-induced disorders and miscellaneous disease. All right, and that book was later on separated into two texts, one on Sanghan Lun, cold-induced disorder, and the other one is Jin Gui Yao Lue, which is more of an internal disorders. All right, so this is how a lot of the disease patterns are first categorized, starting from the signs and symptoms, followed by diagnosis, followed by treatment. And this obviously became the gold standard in traditional Chinese medicine. All right, so from that point on till now, every practitioner of Chinese medicine still study the books from Mr. Zhang Zhongjing. All right, and as far as disease pattern goes, obviously, as we all know, it starts from Taiyang to Yangming to Shaoyang, and then Taiyin, Shaoyin, and Jueyin. The first three are the external stage, the earlier periods of the infection or disease, and the last three are the interior, the more severe cases. All right, I'm going through this relatively quickly because I'm assuming that most of you are all practitioners and you have general idea already. And this is just a very quick refresher. All right, and what happened is the Chinese civilization starts out in the northern part of China, where it's generally speaking more cold, especially in wintertime. So picture yourself, this is like Chicago, this is like Ontario, the northern US, the Canada region. And once again, it's very bitter and cold in the wintertime. And what happened is as time goes on, the northern part of China becomes more and more crowded. So you actually see a lot of people start to migrate. And most of the people migrate south in the China region. And what happened is as they travel farther and farther south, it gets warmer and warmer, okay, and they start to see different pattern of disease. And what happened is, as these people now start to get sick, doctors in the southern part of China, when they treat these conditions, they still apply the same general principles of the 6 stages, Taiyang, Yangming, Shaoyang, and so on. And what happened is they noticed that a lot of these patients are not getting better. In fact, their conditions continue to deteriorate and they eventually die. A lot of patients eventually die. But what happened is Chinese culture generally asks people to be more respectful of the elderly, respectful of the ancient wisdom. So what happened is most of the doctors dare not to deviate from the gold standard of the 6 stages. As a result, they continue to apply the same principle and use the same formula to treat the patients, but they were not really getting anywhere. So as time goes by, finally, some of the doctors start to ask, well, why is this the case? How can we do better? And one of the doctors first started to ask these questions is a doctor by the name of Wu Youxing, all right? And he was the one that eventually started the theory of the worm epidemics, all right? And basically what he said is these worm epidemics are, quote, not caused by wind, cold, summer heat, nor dampness, but rather by something called li qi or perverse qi. And then he further elaborated that li qi, the perverse qi, existed in the universe, but have no sound or smell and no shape or shadow. Okay, and lastly, he observed that this perverse qi is transmitted from one person to another via heaven or earth, basically airborne or via direct contact, and that the people that are weak or deficient are most likely to be affected, all right? So I think this is the very first observation that is not so much the environment, the cold or the hot or the damp that cause somebody to become sick, but rather something else that they cannot see at the time. All right, so basically what he is observing, as we know today, is basically the bacterial and viral infection that you cannot see with naked eyes, but somehow they transmit from one person to another. All right, so Dr. Wu was the first one that started the warm febrile disease. Okay, but his work needed to be carried on and elaborated before Chinese medicine established a more organized protocol on how to best treat these warm diseases. All right. So the next physician that made a lot of progress is a physician by the name of Ye Gui or Ye Tianshi. And his work is Wen Ze Lun, Discussion of the Warm and Hot Disorders. Basically, what he did was took the philosophy from the first doctor, and then he elaborated on the pathology. Basically, he noticed that the disease also starts from the exterior and eventually gradually move interior. And instead of the 6 channels or 6 stages, he differentiated them into 4 levels, which are Wei, Qi, Yin, Xue. So Wei is the defense level. This is the very early stage when the exterior pathogen starts to attack the superficial aspect of the body, and the body's immune system starts to fight against these pathogens. All right, so you can say these are probably the macrophages. These are the early white blood cells that are fighting against the bacteria and the virus. All right, and if the disease continues to progress, you will then go to the qi or energy level. And this is a time when the body is in a full battle with the infection, where there is high fever, there is large pulse, there's sweating, and there's a lot of excessive signs and symptoms. All right, so this is basically the body trying its best to defend against the infection. All right, and in most cases, the infection at that point will gradually subside if the immune system is doing out. And then after that, the patient will heal and recover. But if not, then the disease will continue to deteriorate, eventually end up in the Yin nutritive level, and finally in the Xue blood level. Okay, so the idea is very similar to the 6 stages in the cold-induced disorder. Basically, once again, the disease starts from the exterior and gradually move interior if they are not treated properly. Okay, and the last person, another person that's very important in the Wenbing warm disease is Wu Tang or Wu Jutong, and his book is called Wenbing Tiaobian, Systemic Differentiation of Warm Diseases. All right, and his characteristic that he observed is Sanjiao Bianzheng, triple burner differentiation. Basically, disease are regional, can be localized, but can also travel. Localized refer to the upper, middle, and lower jiao, or they can travel from one part to another part of the body. So if the patient has an upper jiao type of disease, most likely it's a respiratory tract type of infection. If the patient has a middle jiao type of problem, it's most likely a gastrointestinal type of infection and inflammation. And if it's lower jiao, then chances are it's a urinary tract type of infection and inflammation. All right. So these are 3 of the main practitioners who help to shape the Wenbing, the warm disease that we know today. All right. So what happened is as you begin to think about the patient that come in your clinic, about influenza, about viral infection, or it could be even coronavirus, what happened is you want to combine both 伤寒, cold damage, and also 温病, warm disease, as you formulate your diagnosis and formulate your herbal treatment. Because I think both of them has very valuable points that we need to consider and diagnose and treat the patients. All right, so I'll give you some examples of what are the most commonly used herbal formulas and single herbs, what their TCM herbology is, and also what their Western pharmacology is. All right, so as far as 伤寒 goes, 伤寒 is cold damage, starts out with 太阳 stage. All right, so if the patient comes in the early stage, generally speaking, these three formulas are probably the most applicable. One of them is 麻黄汤, a federal decoction. One is 桂枝汤, cinnamon twig decoction. And the last one is 葛根汤, kutsu or puaria decoction. All right, so this is the composition of 麻黄汤. You basically have four ingredients: 麻黄, 桂枝, 苦杏仁, and 炙甘草. Ephedra, cinnamon twigs, bitter almond, bitter apricot, and also licorice. And the idea here is this is a formula that is very potent to release the exterior excess and wind cold syndrome, where the patient has all these signs and symptoms such as fever, aversion to cold, headache, neck stiffness, body aches and pains, absence of perspirations, and so on. And basically what this syndrome is, from a Western perspective, is probably the early stage of common cold and influenza and upper respiratory tract infection. All right. So if you use this formula in the very early stage in somebody who is otherwise healthy and robust, generally speaking, what this formula would do is to help to normalize the physiology of the body and then help the body to heal itself. Okay, meaning this formula is able to open up the blood vessels, increase blood circulation to different parts of the body, and therefore allow the white blood cells to do what it's supposed to do, which is to treat and kill the virus and the bacteria. Okay. Another thing, and this is one of the things that I always wonder, and I'll tell you the answer later on, is that this formula, if you look at it, really has four herbs, but none of them really have a very strong antibacterial or antiviral effect. All right, so if you take these herbs and you put it in a petri dish and you put in bacteria, chances are most of them are not going to kill the bacteria or kill the virus. All right, so what happened is this is not a very good antibiotic herbal formula, but rather it's a formula, like I mentioned, it helps to restore and helps the body to help itself to treat the infection. Okay, the second formula is 桂枝汤 cinnamon twig decoction, and the main ingredients are 桂枝 cinnamon twigs, 白芍 white peony, 炙甘草 baked licorice, 生姜 fresh ginger, and 大枣 jujube or dates. And once again, this is a formula that is mostly for treating the early stage of exterior condition, characterized by exterior deficient and with cold. Main symptoms are headache, fever, mild perspiration, aversion to cold, and some nasal congestions, and so on. And once again, from a Western biomedical condition perspective, this is once again most likely the early stage common cold, influenza, and upper respiratory tract infection type of conditions. And the main difference between this formula and the previous formula is the previous formula, 麻黄汤, is best for somebody who is otherwise healthy and robust. Okay, so they can tolerate the stronger, the more forceful treatment. 桂枝汤 is more suitable for somebody who is having the early stage of common cold, influenza, upper respiratory tract infection, but they are a little bit weak, a little bit deficient. All right, so you don't want to use something that's too powerful, because if they become too weak and deficient from the herbal treatment, then you weaken their ability to fight the infection themselves. All right, so once again, what happened is if you look at the ingredients of this formula, all right, most of the herbs here are not going to be antibacterial or antiviral herbs. All right, so once again, this formula really helps to treat the patient by helping the patient to help themselves. Okay, so in other words, it's more of a supportive treatment. It's more of a formula that helps to bring the blood circulation, bring the white cells to the disease area so the patient can then recover on their own. Okay, and the last formula is 葛根汤 kudzu decoction or pu'aria decoction. The main ingredients are 葛根 pu'aria root, 麻黄 ephedra, 桂枝 cinnamon twigs, 白芍 white peony, 炙甘草 baked licorice, 生姜 fresh ginger, and 大枣 jujube. All right, so formula composition is fairly similar, okay, but it does have 麻黄 ephedra and 葛根, and these are the two herbs that help to treat the early stage of wind cold with very severe muscle stiffness, neck and shoulder pain, and so on and so forth. All right, so once again, from a TCM perspective, it's early stage of wind cold. From a Western perspective, it's early stage of common cold, influenza, and upper respiratory tract infection. All right, and once again, the herbs really do not have antibacterial, antiviral effect. And once again, this is more for symptomatic relief. It's more for supportive treatment. It's to help the body to help itself. All right. And that's perhaps the reason why I mentioned earlier that when the mass population in China start to migrate, a lot of them move to the south. And when they are caught with bacterial, viral infection, different type of epidemic, what happens is when you apply the formula that treat early wind cold to treat these patients, what happens is even though they do have supportive functions, they do help the patient to help themselves, if you end up with a very nasty bacteria or very virulent virus, what happens is helping the patient to help themselves is not going to be enough, right? So what happens is, as we discuss wound being a little bit later, you'll notice that these patients who have severe bacterial viral infections are best treated if you are able to add in herbs that have specific antibacterial or antiviral effect. And then what you'll notice is that the treatment outcome will be a lot better. All right. So I'm jumping the gun a little bit, but I want to get that point in as we finish the early formula for treating the exterior wind cold. All right. So once again, if the disease is not properly treated, then the disease will start to move interior. And then what happens is high fever becomes a very important diagnostic criteria. And high fever is one of the diagnostic signs in the Yangming stage. All right. And the main formula to use in this case are 白虎汤 white tiger decoction and 白虎加人参汤 white tiger plus ginseng decoction. All right. So these are the main ingredients in 白虎汤. You have 石膏 gypsum fibrosin, 知母 animarina, 炙甘草 baked licorice, and 粳米 rice. And this is a formula mainly for treating the Yangming syndrome, where you have excess heat characterized by high fever, flushed face, irritability, thirst, and profuse sweating, and so on. All right, so this is basically the height of the infection where the body is trying to fight back as much as possible. So once again, it's no longer the early stage of bacteria or viral infection, but it's the the peak of the bacterial and viral infection. And what happened once again, if you look back to this formula, again, most of these herbs, whether it's 石膏 or 炙甘草 or 粳米, really do not have any antibacterial or antiviral effect, but rather what they do have is a very strong antipyretic effect. And what that means is these are herbs. This is a great formula to treat the fever. All right. So what happens is when you have this type of heat, using this formula will greatly reduce the fever. But once again, by itself, not enough to treat the bacteria or treat the virus. So once again, it's a supportive formula to help to reduce the fever, but not enough by itself to treat the infection. All right. Another formula that's commonly used is 白虎加人参汤. So basically the same formula with addition of ginseng, which is radix, and rhizoma ginseng. All right. And this is a formula for a patient with the same condition, but what happened is they are starting to become weaker and more deficient. So they have qi deficiency and also body fluid deficiency. All right. So if you see that, then basically this would be a slightly more applicable formula than the formula Bai Hu Tang by itself. All right, so once again, this is for the height, the peak of the bacterial or viral infection with a lot of excess in high fever, flush face, irritability, strong thirst, profuse sweating, and so on. But the patient that need this formula would have some underlying qi and blood deficiency. All right, so once again, none of the herbs here really have any antibacterial or antiviral effect. Once again, it's a great formula for treating heat. It's a great formula with antipyretic effect to lower the fever. All right, and then finally, if the disease continue to move into the lung, there is a formula called 小陷胸汤, so literally minor sinking into the chest decoction, referring to the pathogenic factor sinking into the lung. So now you have lung infection, you have a lot of phlegm and sputum. All right, so this formula has gualo, trichocenthus, huanglian coptus, and banxia penalia. So what happened is now, once you start to see phlegm and sputum, okay, what it is the body and the macrophages are trying to cover up and eat up all the bacteria and virus. And then when that happens, you end up with some sputum and, and pus. Basically, that's a glob of the white blood cells and the bacteria and the virus. And the body is trying to get rid of it from the lung. And that's why they start to cough. They start to cough up the phlegm. All right. So recognizing that there is phlegm, recognizing that this is a active severe infection. Now we see the very first herb that has a strong antibiotic effect, and that will be huanglian, the coptus. Okay, so all the formulas in Sang Han Lun on the cold-induced disorder up till now are formulas that more or less that supportive formula that help the body to help itself. This is the first ingredient. This is the first formula that really does have antibiotic effect. And in this case, huanglian coptus is a much stronger antibacterial herb. It has little, not very strong antiviral effect. All right, so once again, from a Western perspective, you need to differentiate whether it's a bacterial or viral infection and then use drug appropriately. In Chinese medicine, this is an area where we can use more specification, because what happened is we just refer to all these things as heat, whether it's exterior heat or interior heat or lung heat. Okay, but if you can be more specific, is it heat from a fever? Is it heat from inflammation? Is it heat from bacterial infection or heat from viral infection? If we can differentiate that and then use antipyretic herbs with antipyretic effect to treat fever, herbs with anti-inflammatory effect to treat inflammation, herbs with antibacterial effect to treat bacterial infection, and herbs with antiviral effect to treat viral infection, then we will be more precise, we'll be more accurate, and we will get better result. All right, so this is an area where knowing the pharmacology of the herb is going to be very beneficial to writing a more precise herbal formula and getting a better clinical result. All right, and then of course, obviously, gualo, trichocenthus, and banxia penalia are to help with the expectorant effect of actually getting the phlegm out of the lung. All right, so the classic indication of this formula, 小陷胸汤, is the phlegm heat stagnation in the lung, okay, with a lot of lung signs and symptoms. All right, so you can even argue that this is probably early stage or indications of bronchitis or pneumonia. All right, so those are some of the formulas that are commonly used for Sanghan, cold-induced damage type of conditions. So once again, they certainly do have a good place in treating patients with common cold, influenza, upper respiratory tract infection. But I think there are some missing pieces that we can fill in and get much better results. And that's basically what happened in TCM history, as TCM continues to change and evolve to adapt to the disease pattern, to adapt to different kind of illness that we see in our patients today. All right, so Wen Bing is something that I think is very important to learn and master to really treat the patients well. So once again, Wen Bing for these patients, the disease is characterized by warmth and heat, okay, not so much by cold. And once again, the pathology is that it starts from the exterior and it gradually moves interior. It could start from the upper parts of the body and gradually go to the lower parts of the body. And the patient doesn't necessarily have to be exposed to different weather patterns, whether it's cold or hot or damp or so on and so forth. All right. There are 3 formulas that I think are worth learning because they tend to be the most effective. The first one is called Influenza, honeysuckle and forsythia powder. Second one is Sang-ju-yin, mulberry leaf and chrysanthemum decoction. And the last one is Sa Sen Mai Dong Tang, Galenia and Ophiopogonus decoction. So Influenza, I think for most of the practitioners here in the US, is probably one of the most famous and also most commonly used to treat early stage of common cold or influenza. This formula has 2 main ingredients, Jin Yin Hua and Lian Qiao. Jin Yin Hua is Lonicera flower, and Lian Qiao is forsythia fruit. So these are the 2 main herbs in this formula. These are the 2 herbs that are mainly for treating early stage of wound heat, or as wound heat starts to move from the exterior to the throat and start to move interior. So generally speaking, the patient would have signs and symptoms of fever, aversion to cold, slight aversion to wind, little bit of perspiration, sore throat, and so on. Okay, so those are the 2 main herbs. And as you begin to move down the list, there are other herbs such as Jingjie Sui, Shisenopeta, Dandouqi, prepared soybean, Jiegeng, Platycodum, Niubangzi Arctium, and Niubangzi is an excellent herb for sore throat. Then Bohe, mint, Zhuye, the bamboo leaf, Gancao is licorice. All right, so overall, the main herbs are Jininhua, Lianqiao, and Niubangzi. Okay, so this is a great formula to use for the onset of wound being warm disease, for early stage of wound heat, or as wound heat starts from the exterior, but showing sign of affecting the throat and starting to move from interior. Western diagnosis, once again, is the same. It's for early stage of common cold, influenza, maybe pneumonia, maybe upper respiratory tract infection. All right. But like I mentioned earlier, the main difference between this wound being formula versus a lot of the Sanghan formula is that a lot of the Sanghan formulas, the formula are supportive formulas, formula for symptomatic treatment, formula to help the body to help itself. Okay, but the difference here with Influenza and honeysuckle and forsythia powder is this formula actually have ingredients that are antiviral and antibacterial. All right, so if you use this formula at a sufficient dose at an early enough time, then generally speaking, you do have a very good effect to help to directly kill the bacteria and also to suppress the replication of the virus. All right, and then what happens is if you also need to use herbs to relieve other signs and symptoms, then by all means do. All right, but because as you can see, this formula doesn't really treat the other supportive measures. It doesn't really treat the cough. It doesn't really treat the high fever and so on. Okay, so it's hoping to treat the infection, and once the infection is treated, hopefully the fever will also calm down and also other symptoms. All right, so if needed, you may also need to prescribe another formula called Sang-ju-yin, which is mulberry leaf and chrysanthemum decoction. So you have Sangye, mulberry leaf, Juhua, chrysanthemum flower, Bohe, mint, Lianqiao, forsythia, Jiegeng, platycodon, Kuxingren, bitter almond, bitter apricot seed, Lugen, Phragmites, and also Gancao licorice. All right, so this is a formula more for the supportive treatment to help to get rid of the phlegm, help to suppress cough, help to relieve thirst, and help to lower the body temperature. It does have one antiviral herb, which is the Lianqiao forsythia, but overall you can tell it's more of a supportive formula, but not so much for treating the infection itself. And this, from a TCM perspective, is for early stage of wound warmth with cough, mild fever, and slight thirst. Again, Western diagnosis is common cold, influenza, early stage of bronchitis, and so on. Okay, but once again, like I said, this is more for the symptoms, not so much for the actual bacteria or the virus. All right, so you can think about combining Sang-ju-yin with Influenza, and that would be a good combination, or maybe combine inchalsad with a 白虎汤, white tiger decoction, if the patient has bacteria and viral infection and also high fever at the same time. That way, you have formulas or herbs that actually can kill the bacteria and virus. You also have herbs that can treat the symptoms and treat and support the patient. Okay, so I think that would be the best as far as treatment strategies go to compose the formula. All right, and then lastly, what happened is obviously, regardless of whether it's bacteria or virus or fever or inflammation or bronchitis or pneumonia, all these things are heat, right? You have the infection is heat, inflammation is heat, fever is heat. Then what happens is it will cause a lot of underlying deficiency in the patient, even if they are able to successfully overcome the infection, right? So they are generally left with a lot of indeficiency, body fluid deficiency, qi deficiency. Basically, they're going to become very weak, okay? Or if they are treated with either herbs or drugs, okay? Herb, in this case, tend to be more cold in nature, right? You need cold herbs in order to fight the heat infection. And if the patient is treated with antibiotic drugs also tend to be very bitter and cold. Though they are able to treat the infection, they also tend to cause a lot of damage, not necessarily just to the lung, but also to the digestive tract. So the consequence of the infection or the treatment itself is that the patient are left with a lot of indeficiency and qi deficiency. And that's why they are tired, they are fatigued, they take a while to recover. Sometimes they are left with lingering, dry, non-productive cough, right? So it's no longer an infection, but the lung qi is damaged, the lung yin is deficient, and that's why they're coughing, but there's no phlegm, there's no sputum. All right, so at this point in time, what you need to do is to repair the underlying damage so the patient can recover and restore normal health at a faster time. And the best formula to use in this case is Sa Sen Mai Dong Tang, okay, Glenia and Ophiopogonus decoction. It's mainly a formula that nourish in and replenish the body fluid, mostly for the lung and also for the digestive system. So you have Sa Sen, which could be either Nan Sa Sen or Bei Sa Sen, Glenia or Dinophora, Mai Dong or Mai Men Dong, Ophiopogonus, Yu Zu Polygonadi, Tian Hua Fen, Trichosanthus root, Sang Ye mulberry leaf, Bai Bian Dou, Lap Lap, and also Gancao licorice. Okay, so like I mentioned, this is mostly for dryness or heat, damaging the lung and stomach and causing a lot of indeficiency and also possibly qi deficiency. So you have a lot of dryness type of signs and symptoms, including dry throat, thirst, fever, dry coughing, dry sticky sputum, and so on. Okay, so not so much for the infection itself, even though you're going to see bronchitis and pneumonia as indications, but as a sequelae or the consequence of the infection and the treatment. Okay. All right. And then lastly, what also happened is we mentioned earlier that with people moving from north to south and as a disease pattern transforming or pattern characterized by cold mostly in the north and warmth really in the south, what happened is we mentioned that a lot of people die as a result of not being able to overcome the infection themselves, or doctors using the cold-induced type of formula to treat warm disorder. And what happened was there was one formula that was found to be most effective. And what happened to the doctor who composed this formula is instead of hiding this as a personal secret and passing it on only to his disciples or only to his children, rather, this doctor decided to carve the composition or the formula on stone at the most visible part of town. So all the doctors, all the people that pass by can see what is the best treatment for the epidemic. And they can then go get the same herbal formula and treat themselves. So this is a formula that was recognized and passed on and really became one of the best formulas for treating epidemic that's very virulent and also very lethal. All right, so this formula is called 普济消毒饮. 普济 literally means universal benefit. 消毒 is to eliminate the toxin, and yin is decoction. So it's trying to tell you that this is a great formula to eliminate toxin. And toxin in this case means the patient has pus and abscess and sputum and phlegm. So basically indicating there's severe infection in somewhere in the body. And universal benefit means this is a great formula that has a broad spectrum, potent effect to treat all type of infection, right? So in this case, the universe could be a small town, it could be a family, it could be a province, or unfortunately in China with coronavirus, it happens to be probably 60 million people in that universe that's been quarantined. All right. So this formula called 普济消毒饮 universal benefit decoction to eliminate toxin, generally speaking, is one of the go-to formulas to use whenever you have a severe epidemic. And if you try some of the early formulas, whether it's ma huang tang or gui zhi tang or in chao san or whatever, and none of them seem to work very well, this is one of the best go-to formula to use when all else fail. All right. And if you look at the formula, once again, this is a much bigger formula now, because if you want to treat different things all in the universe, then in a way you need somewhat of a shotgun treatment to address different bacteria and different viruses and perhaps their mutated counterparts, right? So you notice there's a lot more herbs that clear heat, but herbs that have antibacterial and antiviral effect, specifically huangqin and huanglian. Huangqin is Scutellaria, and huanglian is Coptis. So these are two of the strongest heat-clearing herbs in Chinese medicine, right, for treating upper jaw and middle jaw. And if you read or study the pharmacology of these two herbs, they are two of the broad spectrum, most potent antibacterial herbs. All right, so if it's bacterial infection, this formula will have very good assurance to treat those bacterial infection. Then you have Niu Bangzi Octium, which is a great herb for treating sore throat and also have antibacterial effect. Then you also have two herbs that are very good for treating heat. One is Lianqiao forsythia, and one is Banlangen isatus. All right, so Lianqiao forsythia and Banlangen isatus are two of four herbs that are very frequently used for treating viral infection. And that will be Lianqiao and Jinlinhua that we mentioned earlier in Chao San, and also Banlangen and Daqingye, which are the root and leaf of the isatus. So these are the heat-clearing herbs that have excellent antiviral effect. All right, so if you consider these four as the chief herb within the formula, you basically have two that are excellent antibacterial herbs and two that are excellent antiviral herbs. So this is once again, a great formula to use, basically regardless of whether it's a bacterial infection or viral infection, okay? And then the rest of the herbs are supporting herbs, if you will, to help to treat the various symptoms, okay? And also get the body to help itself, right? So you have Niu Bangzi, once again, for treating sore throat. You have Ma Bo, which is also great for treating sore throat. Xuanzhen is a great herb for treating heat in the interior if it happens to move further inside, and so on and so forth. All right, so once again, this is a great formula for treating early to peak stage of bacterial or viral infection. It has two of the strongest antibacterial herbs. It has two of the strongest antiviral herbs, and that's why it's one of the go-to formula. If all else fail, if your differential diagnosis and specific treatment doesn't seem to do the job, this is a great, potent, broad-spectrum, herbal, antibacterial, antiviral formula, if you will, formula that helps to treat a lot of different infections, basically. All right, these are the description of TCM applications. Presence of wind, heat, and toxin in the upper jaw and head. So basically, upper jaw, respiratory infection, head, sinus infection, ear infection, throat infections, and so on. All right. Western indications include epidemic, hemorrhagic fever, respiratory tract infection, common cold, influenza, sore throat, and so on and so forth. All right. So this, like I said, is one of my favorite formula for all the reasons that I mentioned earlier. All right. So now let's dive in a little bit deeper and talk about the more specific with herbology and pharmacology, even though we already mentioned a lot of those as we talk about many of the formulas. So once again, this is an area where I think TCM can be a little bit more specific when they differentiate heat. So instead of just saying heat, maybe exterior versus interior, excess versus deficiency, or 脏腑 organ that has heat. Okay, so historically, this is how we have always differentiated heat in Chinese medicine, right? So obviously, exterior refer in most cases to the early stage infection. Interior is more severe. Excess, patient may be more healthy and robust. Deficiency, maybe they are weak, maybe the geriatric patient, maybe people that are more likely to suffer infection and have more severe consequence. And then 脏腑 tells you where the infection is in most cases. So if they have lung heat, most likely it's a lung infection, bronchitis or pneumonia. If they have bladder damped or lower damped in the lower jiao, chances are it's a urinary tract infection. But in Western medicine, their terminology is different. They generally have terms such as antibiotic, which can then be differentiated into antibacterial, antiviral, antifungal. So based on the lab test and differentiation of what type of bacteria it is, then certain antibacterial will be prescribed. Based on what type of virus it is, then different antiviral drugs will be prescribed, and so on. And then, of course, if the patient has fever, they will prescribe antipyretic drugs. Could be Tylenol, could be ibuprofen, and so on. And then if the patient also have inflammation, they will use different drugs to reduce inflammation. It could be steroids or it could be NSAIDs. All right. So once again, let me give you some of the herbs that are most commonly used that have antibacterial, antiviral, antipyretic effects, those type of things. So, 金银花, Lanisra flower. The classic description is it clears heat and also clears heat and eliminate toxins. All right, so heat in this case could refer to the fever, inflammation, or infection. But when you do see the words toxin once again refers to the presence of pus and abscess and phlegm and mucus. So there is some type of active infection. All right. And if you look at the pharmacology, this herb definitely has antibacterial and also antiviral effect. And if you're interested and dive even deeper, 金银花 has a broad spectrum or inhibitory effect against various bacteria, as you can see here. But it also has very strong antiviral effect as well. Some of the antiviral effect are against influenza virus, respiratory virus, against specific influenza virus H through N2, Coxsackie virus, okay, and so on and so forth. Okay, so there are a lot of research on this type of things if that's what you are interested in. And all the references are listed, by the way. All right, so it's not just antibacterial or antiviral as a general category, but specifically what virus or what bacteria that the herb has been studied to be effective against. All right. The second herb is Lian Qiao forsythia, clears heat and eliminates toxins. So once again, not just clears heat for treating wound heat or lung heat, but also eliminate toxin, telling you that it's good for treating pus, abscess, phlegm, sputum, active infection type of problems. Primarily is an antibacterial herb, okay, and these are the bacteria that has been shown to be treated by Lian Qiao. And at the very bottom, you will see that it's also effective against some influenza virus. So it's more of an antibacterial herb, some as an antiviral herb. And that's why, once again, if you combine Jin Yin Hua and Lian Qiao together, you have both covered if you are not sure in the early stage whether it's bacterial or viral. All right. The next pair of herbs are the Isatus herbs, Isatus root and also Isatus leaf. Isatus root is Banlan Gen. This herb clears heat, eliminates toxins, cools blood, and benefit throat. Right. So clear heat once again could refer to fever, inflammation. Eliminate toxin tells you that it's good for treating infection. Okay, and once again, if you see pus, abscess, if you see phlegm, if you see sputum, it tells you that there's some type of infections in the body. If it cools heat, cools blood, that means the disease most likely has moved further interior. The patient is getting weaker, okay, and then at the same time, it also helps to relieve sore throat. So this herb has a broader effect from a pharmacological standpoint. It's good as an antibacterial, It's good as an antiviral. It's good as an anti-inflammatory. All right, so anti-inflammatory a lot of time happens as a response by the body to fight the infection. So what happens is as the bacteria or virus is being killed, what happens is then the lipopolysaccharides or the immune system triggers fever. It causes inflammation. All right, so when you treat these type of bacterial and viral infection, it's not enough to use herbs to kill the bacteria or to kill the virus or to reduce the fever. You also want to use herbs that reduce inflammation and take care of the toxin, which is a byproduct from the bacterial and virus infection. All right, so Ban Lan Gen does a little bit of all that. Okay, so that makes it a great herb. Okay, so pharmacologically, it has antiviral effect, and the specific effect is against influenza A virus, seasonal influenza virus, human or avian influenza virus, novel swine influenza virus, Japanese encephalitis virus, adenovirus, cytomegalovirus, swan virus, and so on and so forth. Okay, so once again, a lot of the research has been done to see which herb are effective against bacteria or virus infection, and more specifically, which bacteria and which virus. And in fact, there is an effort, and this has been going on for quite a while now, to take all the herb in the Chinese material Medica and apply it to all the bacteria that are commonly seen and all the viruses that are commonly seen. So there is a good database of which herb to use against which bacteria and also which herbs to use against which virus. So these are the small pieces of the puzzles that they are starting to research, and with enough time, these small pieces of the puzzle will come together and will give us a very good picture. All right, so this is an ongoing effort, and as I continue to read and translate and research, as you know, I do regular weekday webinars and weekend webinars. As I learn more, then I will continue to share it with all of you. All right. Then you have Tcm, which is the Isatus leaf. And once again, this is an herb that clears heat and eliminates toxins. So great for treating the symptom and also the infection itself. Cools blood and also eliminate macula. All right, so this is the spots on the body, kind of like scarlet fever. And once again, very broad spectrum of pharmacological effect: antibacterial, antiviral, antitoxin, and also anti-inflammatory. Specific antiviral effect includes influenza A virus, Japanese encephalitis virus, adenovirus, herpes virus, hepatitis virus, and Coxsackie virus. All right, so those two are pairs, Ban Lan Gen and Tcm, that are usually used together, similar to Jinlin and Lian Qiao, which are a pair and that are commonly used together. So most of those you are probably familiar with. And now let me introduce you to two herbs that you may or may not be familiar with. The first one is called Yu Xing Cao, Herba Hutanania. Yu Xing Cao literally means smelly fish herb. Okay, but actually it's not that smelly. In fact, a lot of people in China actually eat this as salad, or stir fry it and then eat it. Okay, so it actually doesn't taste that bad or smell that bad. This herb is an herb that clears heat, eliminates toxins, and also drains pus and promotes normal urination. So it's a great information to treat fever and inflammation, treat bacterial or viral infection, eliminate pus. And when it's an herb that promotes normal urination, chances are it's also a great herb for treating urinary tract infection. And if you are now better able to interpret the Chinese description, chances are you'll know that this herb has antibacterial, antiviral, and also anti-inflammatory effect. Okay, and specifically, Yu Xing Cao has antiviral and also virucidal effect. And the difference between the two is antiviral generally is a more generic term that says the herb or drug or the medicinal substance has effect against virus, generally speaking by stopping the replication or slowing down the replication of the virus. And when it says virucidal, that means the herb actually has an effect to go in and kill the virus or break down the viral particles. All right. So virucidal effect generally is stronger than antiviral, is stronger than viral static. All right. So Yu Xingye has antiviral and virucidal effect against many different type of virus, including herpes simplex virus, a cyclovir-resistant herpes simplex virus, coronavirus in the case of severe acute respiratory syndrome. So this is a coronavirus in the SARS. But what happened is this current strain is called novel coronavirus. So the original name was 2019 nCoV, referring to novel coronavirus. And the current name is COVID-19, coronavirus disease. So the main thing you want to keep in mind is this current strain is different from the SARS coronavirus, even though they are both categorized as coronavirus. All right, so whether these herbs work against the current strain or not, we don't really know at this time. Okay, but if you were to select an herb or select a few herbs, I think this is an herb that's definitely worthy of consideration. All right. Other viruses include H1N1, influenza virus, pseudorabies herpes influenza virus, and human immunodeficiency virus. So once again, this is an herb with a wide spectrum of antiviral effect. And once again, if you are interested to learn more, there are a lot of research, as I have indicated at the bottom of the PowerPoint slide. Okay, and the last herb that most of you probably have not heard of is an herb called Xiangcunye, Tuna sinensis. And the TCM description is that this is an herb that clears heat and eliminates toxins to treat lung, heat with cough. It also clears heat and eliminates toxins from the skin to treat sores and abscess. So what we are most interested in is the ability of this herb to clear heat and eliminate toxins from the lung to treat lung heat and cough. All right. Historically, this herb hasn't been used as much, or hasn't been used at all. In fact, I'm not aware of the use of this herb in any of the classic formulas. Okay, so this is an herb that's getting a lot of renewed interest in how it can be best used. And what I have found is that this herb has a very good antiviral effect. It exerts antiviral effect by inhibiting the replication of coronavirus to treat severe acute respiratory syndrome, SARS. All right. And this is an effort that I've done. They basically take all the herbs in Sanghan Lun and Wenbing Lun. So basically all the single herbs that I mentioned in the formula among Sanghan and Wenbing, cold damage and warm disease, tested them in the lab, and they found Xiangcunye to be one of the most effective herbs to treat the virus. All right, so this is basically looking at each individual herb somewhat from a Western pharmacological perspective, and they found this to be one of the most effective. All right, so once again, of all the herbs I have seen, I only have seen 2 references of herbs specifically in the lab for coronavirus, and that would be Yu Xing Cao and also Xiangcunye. Okay, and lastly, these are some of the herbs for supportive treatment. One is Sigao. Like we mentioned, gypsum is a great herb to clear heat, primarily as an antipyretic herb to treat fever. Okay, and Sigao is generally used with Tcm and Marina, and the reason is because Sigao has a quick and potent onset, so it lowers the fever very quickly, but the effect also runs out very quickly. And that's why Tcm is used, because Tcm has a more sustained effect. So we'll keep the fever low for a longer duration of time. All right, so the graph looks like this. The green refers to Sigao, rises very quick in potency effect, but drops out after about 4 hours. And then Tcm will sustain the effect from about hour 2 all the way to hour 8. And that way, if you have somebody with fever, you don't have to retake a formula with Sigao every 4 hours, which is very hard for the patient to comply. And then finally, the patient have a lot of fever and inflammation and and so on. So if you look at Western disease name, anything that has an itis, right, bronchitis, pneumonitis, arthritis, colitis, anything that has an itis means there is inflammation. Then Zhizi gardenia is one of the best herbs to use because it's a great herb to treat inflammation. Okay, Western pharmacological effect includes antibacterial, antiviral, antifungal, but personally I think it's best as an anti-inflammatory herbs. All right, so if you have, once again, whether the patient has hepatitis, gallbladder inflammation, pancreatitis, gastritis, and so on, any of the itis, you can use Zhi to help to reduce the inflammation and the swelling. It's one of the best herbs to use. All right, and this is a mechanism behind. Oops. That's a mechanism behind why Zhi works very well as an anti-inflammatory herb. So I'm going to have Sam come back real quick and restore our PowerPoint. I'm not sure what just happened. Sorry, minor technical difficulty. Yeah, so this is our PowerPoint. So you can tell this is live. It's not all perfect. We're almost there. Okay, so just maximize it. Yeah, okay, there we go. That's fine, that's fine. Okay, I'm going to be a little bit over, maybe another 5 minutes or so. Okay, so hopefully you have time to stay till the end. All right, so this is something here. Published recently by JAMA, Journal of American Medical Association. And this is one of their most unique findings about the current novel coronavirus infection. And this was published on February 5th, 2020. And basically at that point in time, there were about 20,000 cases of infection reported, confirmed, about 400 deaths. Most of them are in China. But what they have found is that most of the patients is between the age of 49 to 56. And it's very rare in children, only 2 cases. All right. So this is actually very similar to the original finding in Wenbing, right? Where they described the Li Qi, the perverse Qi, to have no shape and no smell and no sound, right? And that is most likely to affect people that are weak and deficient, right? So what happened is the older patients are most likely to be affected by the novel coronavirus, and the young children generally are not. And even if they are affected, generally speaking, it comes and goes, not any more significant than a case or influenza. And the rationale, according to JAMA, is that the innate immune system in the children is most active in children and is what helps the children to fight off the infection. But the adults, generally speaking, are not as adaptable, especially the ones that are older and maybe more weak and sick. They tend to get it more often, and then it tends to have more severe consequence. All right. So Western medicine does acknowledge that the health of the patient, the immune system of the patient plays a very important role. But unfortunately, there is really no drug that the patient can take to boost or strengthen the immune system. And this is one of the main advantage of the Chinese herbs. That is, we emphasize on prevention, we tonify qi if the patient is qi deficiency. And if the patient is wei qi deficient, that means they have defensive qi weakness. Then what you can do is you can use herbs that have immunostimulant effect. So these are the herbs that tonify the wei qi that will help to boost the immune system. And the purpose of me writing this slide is not for you to write down very quickly all these herbs, but rather to tell you that there are in fact many herbs and many choices to choose from. It doesn't have to be one specific herb or one specific formula. There are, once again, plenty of choices. But if you need to narrow down to one, then obviously the best choice is Yu Ping Feng San, jade windscreen powder, with Huang Qi astragalus, Bai Su atractylotus, and Fang Feng Siler or Saponis covea as the 3 main herbs. And in Chinese medicine in the past, they use windscreen or jade windscreen as the metaphor that it will help to provide the separation. In a way, very similar to the mask, to the goggles, to the glove, or the quarantine concept, right? So this is the formula that helps to boost your immune system. So in a way, that even if you're exposed to the Li Qi, the perverse Qi, chances are you will not be affected, or you're much less likely to be affected. All right. So as practitioners in the United States, once again, there are only 15 cases of coronavirus here in the US. Chances are none of us will personally treat coronavirus. But if we do, or if you have patients that are concerned, I think the best thing to do is, other than the standard recommendations of wear masks, wash hands and so on, the best formula to take is this particular formula, Yu Ping Feng San, or single herb astragalus, because if you are able to boost the immune system for the patients, they are much less likely to catch an infection. And if for some reason they do, and they start to show early signs and symptoms, then you go back to what we mentioned earlier. You start then to pick some formulas, whatever that is most suitable for the patient, to then treat the infection itself. All right, so I think that is the best way to help the patient with prevention and also treatment. And I hope that gave you a big picture of what to do and also what formula to use and how to best treat the patients. All right, so once again, these are the TCM descriptions, 胃气 deficiency, and also Western indications, prevention of upper respiratory tract infection, and also to strengthen the immune system. All right, and I'll leave you with one of my favorite slides. This is a cover of a book called The Sanford's Guide to Antimicrobial Therapy 2020. This is 2010. So this is actually the 50th year. And I first come across this book actually in the first week of my pharmacy school. I remember going to the bookstore to buy books, and then I come across this book. And I went to TCM school before I went to pharmacy school. So when I saw this, I got really excited. And the reason is because from a pharmacy perspective, this is considered to be the Bible for doctors that treat infectious disease, because it lists out all the antibiotics and what the most current recommendation is as far as what drug and what dosage. But from a TCM perspective, what happened is there are two Chinese characters on here, right? And if you open up and look at the inside front cover, it gave credit to Chinese medicine. So these two Chinese characters means 热病, heart diseases. And then it goes on to elaborate that what Chinese medicine describes as heart diseases is what we know today as the infectious disease. And what we know as the cold herb in Chinese medicine in the past are the origins for a lot of the discovery of antibacterial herbs and also antiviral herbs. All right, so in a way, this is the unification or integration of both Chinese medicine and Western medicine, and also drugs and also herbs. So I thought this is a great way to end our talk today. And actually, lastly, Donna mentioned earlier that we are sending out an article about how Chinese medicine, or how coronavirus is currently treated by Chinese medicine in China right now. And it's basically a translation and compilation, because like I mentioned, once again, none of us have really any direct or personal experience in this area. So we have to learn by what they are doing and what they are learning. And if you are looking for one empirical formula, so to speak, this would be the one. This is called 清肺排毒汤, clear the lung and eliminate toxin decoction, basically for treating lung heat and also to treat the infection. And as you can see, the first four herbs are from Sanghan Lun, Ma Xing Gan Si Tang. And there are also a lot of other herbs that have antibacterial and antiviral effect. So this is what they are using in China right now as a quote-unquote empirical formula. And then if you're looking for a more specific differential diagnosis type of things, then it's described in the article what different stages are and what different formulas are. And at this particular time, if you are interested, once again, contact Donna, and then she will be more than happy to send you that article. And this is the original link. All right? And this last formula, this last overhead, is the picture of Dr. Wu Youxing. Okay, and he was, once again, the very first person that started the discovery of Wenbing, warm febrile diseases. And back then, what happened is there's no mask, there's no goggle, there's no glove. So you would first personally go to the front line to interview the patient, observe the signs and symptoms, try to notice the pattern. Okay, so he basically risked his life to help to treat the patients. All right, so he really is a hero in terms of treating warm febrile disease. And then finally, and I said that a couple times already, but this is really the finally. If you are looking for additional reference, these are the official reference from the WHO, CDC, FDA, and also NIH. If you're looking for something that's more Western medicine, more contemporary, this is the reference for New England Journal of Medicine, JAMA, and also the Lancet. All right. And then if you have any specific questions for me, My doors are always open. Feel free to call me or send me an email. I will be more than happy to answer any of the questions you have. All right, so thank you very much.
All right. Thank you, Dr. Chen, and thank you everyone for joining us today. So if you want to get a hold of that article, the link has been posted in the chat room. You can also find it in our website under free stuff and then clicking on articles. So it'll be the first one that you will see, and you'll also see other free articles that we have listed there. So if you want to check them out, you are more than welcome to. You can either read them on our website, or you can also download a PDF version of it. All right, today's class has been recorded, so if you'd like to watch it again, you can log into your eLotus account and find it on our Tcm Wisdom Tube tomorrow afternoon. That's it for today, everyone. Thank you so much for joining us, and we'll see you at the next webinar. Bye.